Puberty in females generally begins between the age of 8 to 13. Their bodies go through various changes such as breast development, growth of body hair, wider hips, vaginal discharge, and periods. Periods are also referred to as menstruation. Which organs are responsible for your periods and where are they? The female reproductive system is a set of internal and external organs that have several functions. It consists of the uterus, ovaries, fallopian tube, cervix, and the vagina. The uterus is hollow and pear-shaped and is located in the lower abdomen. Ovaries are located on either sides of uterus and act as a storehouse of eggs. The fallopian tubes are finger-like structures that connect the ovaries to the uterus. The mouth of the uterus is known as the cervix, which opens into the vagina, that is an external part of the body. What really goes inside a female reproductive system in a menstrual cycle? Each month, an egg is released by one of the ovaries. This egg is transported to the fallopian tube where it waits for a sperm cell for fertilization to happen. The process of fusion of egg and the sperm to form a baby is known as fertilization that happens when a male and female have sexual intercourse. Every month, the uterus, also referred to as the womb, forms a lining of blood and glands that act as a cushion for the baby and provides nutrition to it. This lining is called the endometrium. If pregnancy occurs, the fertilized egg eventually implants itself into the endometrium. However, in the absence of fertilization, that means when there is no pregnancy, the cushion lining that is formed is not required anymore, and the lining is shed out of the body. The lining that is shed then passes through the cervix and finally comes out of the body from the vagina. This process is what is commonly called periods or menstruation. Periods typically last for around 3 to 7 days. This entire process of eggs maturing in the ovary, their transportation to fallopian tubes, the formation of the lining of the uterus, and its eventual shedding is known as menstrual cycle. This process is controlled by hormones released from the brain. An average menstrual cycle's duration is 21 to 35 days. The lower part of female human body consists mainly of 3 openings: urethra, vagina, and anus. They are arranged in an order from front to back. Urine passes through the urethra, menstrual blood passes through the vagina. In case of pregnancy, the baby is also delivered through the vagina. Stools are passed out from the anus. The uterus contracts itself to shed the lining, resulting in menstrual cramps and period pain. Menstruators might experience certain symptoms before and during their periods, that is known as premenstrual syndrome (PMS). These symptoms vary with every menstruator, but generally consists of water retention, acne, breast tenderness, bloating, swelling in limbs, face or feet, mood swings, cramps, change in appetite, backache. Period products. A menstruator experiences period for the first time anywhere between the age of 9 to 15. That is called menarche. Menstruation stops on an average by the age of 40 to 50. This time frame is referred to as menopause. From menarche to menopause, a menstruator will experience periods every month, and therefore it is important to know about various products which can be used during periods. Let's divide the products into 2 categories: disposable and reusable products. Let's discuss disposable products first. Disposable products cannot be reused. They are not an environment-friendly option and are heavy on the pockets compared to their sustainable counterparts. Sanitary pad. Sanitary pad is one of the most commonly used period product. It is to be stuck to the inside of an underwear. A sanitary pad absorbs the menstrual blood and should be changed every 4 to 6 hours to prevent infection. Tampons. A tampon is inserted into the vagina using an applicator or a finger. Tampons have a string attached to the end that stays outside of the body. This string is used to pull the tampon out of the vagina. Tampons should be changed every 4 to 6 hours in order to avoid dryness and bacterial growth as it absorbs blood from inside the vagina. Always remember to wrap disposable products before discarding them so the bacteria and infections do not spread. Some prefer to wash sanitary pads before disposing them off, which is also another option. They should not be flushed in the toilet as they can clog the drains. Moving on to reusable options that are available. Let's start with cloth pads. Cloth pads are made out of cotton and they can be placed on the underwear like a sanitary pad. They absorb menstrual blood. They need to be changed every 4 to 6 hours. However, unlike sanitary pads, they do not need to be disposed of. They can be washed with soap and water, soaked and dried under the sun. Cotton pads can be reused for approximately 4 to 6 years. They are easy to use and are sustainable. Period panties. They look like regular underwear except they have a special absorbent layer which prevents leakages onto clothing, and as they are washable, they are one of the most sustainable options available. Menstrual cups / disc. A menstrual cup is inserted into the vagina. One can use various folds for insertion and the cup forms a vacuum inside the vagina, ensuring that it does not fall off or slip out. Instead of absorbing blood like tampon, the cup collects it inside the vagina. Menstrual cups are made up of medical grade silicone, which makes it safe and sustainable to be inserted within one's body. One can use menstrual cup for 10 to 12 hours depending on one's flow. Once the cup is full, one can press onto the lower tip and release the vacuum and pull it out slowly out of the vagina and empty the collected blood. The cup needs to be cleaned with water before inserting it back into the vagina. At the end of each cycle, one can sterilize it with warm water and keep it ready for use for the next month. One cup / disc can be used up to 10 years, which makes it economical as well as sustainable. Hygiene. One needs to always wash their genital area from forward to backward, that is, from urethra to anus, in order to prevent any kind of infection. One should always use warm water and or a non-scented soap to clean the outer area. Vagina is capable of cleaning itself. Hence, we need to make sure that no product goes inside the vagina as it can lead to itchiness and irritation. During periods, it is advisable to wear loose-fitting clothes and clean cotton underwear to prevent causing moisture. The loss of blood during periods can cause iron deficiency, and hence it is advised to have iron-rich food like leafy vegetables and fruits. It is advised to avoid consuming salty and fried food items and caffeine as they lead to water retention and bloating. One should focus on their water intake and drink a lot of water in order to avoid dehydration. If the menstruator feels fatigued or nauseous, it is advisable to rest. One can exercise while ensuring they avoid strenuous activities that might make one feel fatigued. When should one visit a gynecologist. It is advised to visit a doctor in cases where the menstruator experiences periods for more than 7 days or less than 3 days. In case of excessive blood loss, where they bleed heavily during their period cycle or experience light spotting during or after their periods. Periods that occur less than 21 days or more than 35 days apart or missing 3 or more periods in a row is considered irregular. Tracking one's period cycle can help a menstruator identify if they experience irregular periods. In case of unbearable pain, cramping or nausea that disrupts the daily routine.